In this video, we'll do an exam review on epidural hematoma. Epidural hematoma occurs in the epidural space. So where is epidural space? Epidural space is the outermost space and is between the dura mater and the skull bone. Three layers covering the brain and spinal cord are: number one, dura mater, outermost; arachnoid matter, the middle one and is avascular; and the pia mater is the innermost. So what happens in epidural hematoma? Severe cerebral compression causes temporal lobe herniation leading to death. So CT and MRI should be done quickly, as mass effects and increased intracranial pressure may be life-threatening. Epidural hematoma may be caused by contusion, and in 10% of cases of severe head injuries, it causes cortical damage. So in severe head injury, 10% cases causes cortical damage, and it's the outermost space. So in epidural hematoma, CT and MRI should be done quickly. Why? Because a mass effect and increased intracranial pressure may be life-threatening, and it occurs in 10% of cases of severe head injury. So what happens in epidural hematoma? What type of bleeding is that? There is arterial bleeding after the skull fracture at the pterion. And where is pterion? Pterion is at the junction of temporoparietal bone, in which middle meningeal artery, which is a branch of maxillary artery, is ruptured, causing bleeding in the epidural space. And as I earlier mentioned, epidural space is between the skull and the dura mater, and it produces a biconvex shadow. So what are the features of epidural hematoma? Patient is asymptomatic. There is lucid interval. Sign symptoms develop suddenly. Why? Due to rapidly expanding hematoma due to arterial bleeding that produces increased intracranial pressure, bradycardia, and brain herniation. And deterioration in the mental function leads to sudden death due to respiratory arrest. So this is known as drop and die syndrome. So there is arterial bleeding in the epidural hematoma and a rapidly expanding hematoma. The bleeding is from the middle meningeal artery, and that causes increased intracranial pressure, bradycardia, and brain herniation, leading to sudden death. That's known as drop and die syndrome. Bleeding can cross the middle line, but rarely or does not cross the suture line. So the bleeding can cross the middle line as opposed to the subdural hemorrhage, which does not cross the middle line. Amongst the investigation, X-ray skull shows fracture and fissuring at the fracture point, and CT and MRI show lens-shaped biconvex hematoma, and they should be done quickly, as mass effect and increased intracranial pressure may be life-threatening. And cerebral angiography shows bleeding point at the middle meningeal artery at pterion, and the treatment is surgical evacuation, cautery, and ligation of the artery.